you crazy? We're not going to kill our dog.
The fastest way to resolve this is to euthanize the dog and get the finger out.
The man had a section of his finger cut off by a table saw, and the family dog swallowed it. So now there were two questions. How do you get the finger out of the dog's stomach? And after that, can it still be reattached?
It should be on iced, saline-soaked gauze, not in a dog's digestive juices.
The man said he was a pianist and his fingers were critical. He told the team he'd accidentally cut off part of his finger on a table saw. Even worse, the piece that hit the floor was eaten by their pet dog. His wife brought the dog to the hospital and the dog was quickly taken to CT. On the CT images, everyone could see the finger segment clearly. The ER doctor told him that if he wanted any chance of reattaching it, the piece had to be preserved and intact. But now it had been inside a dog's stomach surrounded by digestive fluid. Could it still be reattached? The man wouldn't let it go. He told the doctor that if the finger couldn't be put back on, his career would be finished. He couldn't accept that kind of loss, but the question was still the same. How were they supposed to get the finger out? The ER doctor suggested killing the dog, because that would be the fastest way to retrieve the finger. His wife collapsed emotionally.
We're not going to kill our dog.
Your dog.
What are you saying? That your piano playing is more important than Matilda's life? Look her in the eye and tell her that.
She held the dog tight and said there was no way she would let them kill it for a finger. George went stiff too. His finger was his career, but the dog was also family, and he didn't want the dog killed either. Time kept passing, and the longer the finger sat in stomach fluid, the greater the risk. In the end, the ER doctor came up with another option: do surgery on the dog and remove it from the inside. But the surgeon refused right away. This wasn't a veterinary hospital, and they weren't going to open up a dog. So the ER doctor called G. He knew an endoscope can retrieve objects without surgery. You pass a flexible scope into the stomach, use a snare loop to catch the object, and pull it out. He'd pulled all kinds of strange things out of human stomachs, but pulling a finger out of a dog's stomach was a first. Then they ran into the endoscopy nurse manager. She said policy didn't allow pets in the procedure room, but George was waiting, and every extra minute meant more digestion and a smaller chance of ever getting that finger back. In the end, she agreed. What happened next looked surreal. The dog was given an ID wristband and its patient information was checked. Someone even forced a tiny surgical cap onto its head. Then a pediatric scope went down into the dog's stomach. Once the snare found the right position, the finger was pulled out quickly. They rinsed and treated the finger right away, then sent it straight to the operating room. A few months later, George came back for follow-up with his wife and that same little dog. The finger looked okay, and he had already started practicing piano again.